42 CFR Part 2 violations now carry up to $250,000 in fines and 10 years imprisonment, and most treatment centers are exposed. If your program accepts Medicaid, Medicare, or any federal funding, Part 2 almost certainly applies to you. What Part 2 is, who it covers, how it differs from HIPAA, the 2024 rule changes, and the most common violations. This is the essential briefing for treatment center operators, clinical directors, and compliance officers. The old $500 first offense penalty is gone. Criminal exposure is now HIPAA aligned. Under the previous rule, a first Part 2 violation carried a $500 criminal penalty. A subsequent offense was $5,000. The 2024 final rule replaced those penalties. The most serious offenses now carry up to $250,000 and 10 years imprisonment. Civil penalties now follow the HIPAA structure. $100 to $50,000 per violation, with annual caps up to $1.5 million per violation category. 42 CFR Part 2 is a federal regulation administered by SAMHSA protecting SUD treatment records. It was enacted because individuals avoided addiction treatment, fearing records could reach employers, law enforcement, or insurers without their consent. Disclosure of SUD records can cost patients jobs, housing, and custody. Part 2 removes that barrier to treatment seeking. Part 2 applies to any federally assisted program providing SUD diagnosis, treatment, or referral. If your program accepts Medicare or Medicaid reimbursement for SUD services, Part 2 applies. 501c3 organizations providing SUD treatment are covered. Federal grants, DEA-registered methadone and buprenorphine programs, and IHS or VA-funded programs are all covered. A generic EHR has no SUD record segmentation, no Part 2 consent tracking, no redisclosure notice generation. A purpose-built behavioral health EHR is designed to support consent tracking, record segmentation, and redisclosure notices as standard workflows. An EHR not configured for Part 2 creates systematic risk of unauthorized disclosures across every patient record it touches. Part 2 builds on 4 core obligations. All 4 must be in place. They interact. Let us walk through each one. Before disclosing SUD records, the patient must sign a written consent form. The form must include all elements defined by 42 CFR, Section 2.31. HIPAA authorization forms do not satisfy Part 2's specific requirements. Using the wrong form is one of the most common violations. The receiving entity cannot further share SUD records without new patient consent. The disclosing program must include a written notice. The information cannot be further disclosed without patient consent. A hospital holding Part 2 records cannot reshare them under standard HIPAA rules. Part 2 governs regardless of who holds them. A standard subpoena does not authorize disclosure of Part 2 records. A specific court order is required, one with a judicial finding that the public interest outweighs the patient's privacy interest. Producing records on a standard subpoena without a valid Part 2 court order is a violation, even if it would satisfy HIPAA. Your EHR must be configured to support Part 2. Segmentation, access controls, consent tracking. Your system should track consent forms and generate Part 2 compliant redisclosure notices in standard disclosure workflows. An EHR not configured for Part 2 creates systematic unauthorized disclosure risk across every patient record. The 2024 final rule from HHS made the most significant changes to Part 2 since the 1970s. Patients can now sign a single consent authorizing all future disclosures for treatment, payment, and healthcare operations. Part 2 breaches are now subject to HIPAA civil monetary penalties and breach notification requirements. The 2024 rule explicitly prohibits using SUD records to make adverse decisions about employment, housing, or education. These are the Part 2 failures treatment centers encounter most often. Part 2 consent forms have specific required elements HIPAA authorization forms do not meet. Producing records on a standard subpoena without a Part 2 court order is a violation. Every consent-based disclosure must include written notice that records cannot be further shared without new patient consent. Acknowledging to a caller that a person is a patient is a potential Part 2 violation. Staff training must cover these scenarios. Stop letting an unconfigured EHR create Part 2 exposure. Book a 20-minute demo at behavehealth.com. See how a purpose-built behavioral health EHR is designed to support Part 2 consent, segmentation, and disclosure workflows.